Hello, my name is Nikita Demas, and today I will be discussing the skin condition vitiligo with you guys. And this is just my table of contents that I'm going to be going through today and teaching you guys. To begin, vitiligo is a condition in which your skin tends to lose pigmentation. Your skin will turn white or appear lighter than it would naturally. Your hair can become white or silver if there is vitiligo on a hairy area of your body. Melanocytes are destroyed by the immune system of the body, resulting in the condition. Skin cells called melanocytes happen to be responsible for the production of melanin, which is the pigment that gives your skin its color. All genders and races may be affected by vitiligo, but people with a darker skin tone might attract the condition easier than others. Even though vitiligo may affect anyone at age, patches of the condition typically appear before the age of 30. People may be more at risk of vitiligo if they have conditions such as anemia, Addison's disease, type 1 diabetes, psoriasis, lupus, rheumatoid arthritis, and thyroid disease. Features of vitiligo include hair turning white or gray, hair loss, very easily sunburned, hearing loss, color of eyes may change, and a patch of scalp hair, eyebrow, or eyelash hair may turn white. Skin or mucous membrane patches get discolored. These might look whiter or more pale than the normal color of your own skin. A small portion of your body may be affected by minor symptoms, whereas a huge portion of your body may be affected by severe ones. Before depigmentation begins, some vitiligo victims have itching skin. Vitiligo symptoms might show up on any part of your body. Vitiligo is normally found on the face as well as the lips, nose, inside of the mouth, hands, arms, feet, and genitals. No one knows the true reason vitiligo occurs, but studies have shown that it may be related to stress, regular stress, or physical stress on the body, particularly following a traumatic or big life event. This can affect the quantity of pigment that your melanocyte cells generate. Another cause is emotional triggers. An individual's melanocyte cells' ability to operate can be influenced by factors like exposure to harmful chemicals and UV rays. Another cause is genetic shifts. There are more than 30 genes that can make your body more vulnerable to vitiligo. The way your melanocytes work may be impacted by genetic changes or alteration to the body's DNA. The last known cause of vitiligo is a condition called autoimmune arthritis. This condition occurs when your immune system views healthy cells, known as melanocytes, as possibly damaging foreign invaders such as germs. The immune system reacts negatively as a result, which produces antibodies that kill the melanocytes. Since vitiligo is purely cosmetic and not damaging to the body itself, treatment is not required. Your doctor may help you in finding a treatment option to achieve an even complexion by either removing the remaining color, known as depigmentation, or restoring color, known as repigmentation, if the vitiligo is largely spread or physical symptoms negatively impact one's mental health. Typical therapies for vitiligo consist of medications. While there isn't a specific prescription that can prevent vitiligo appearing, several medications can help melanocytes grow again, as well as slow down the rate in which pigmentation is lost. They can also restore color to the skin. Certain medications include topical Janus kinase inhibitors, also known as ruxolitinib, corticosteroids, and calcineurin inhibitors. Some treatment options include surgery, which may include skin grafts or blister grafting. Light therapy, which is also known as phototherapy, will help restore the color of skin. Repigmentation therapy, which also removes the color of your natural skin tone. As a result of this, therapy will match your skin to the given vitiligo skin tone. And lastly, counseling, which would include meeting with people to boost self-esteem and try to get rid of any stress, anxiety, and depression the vitiligo may have caused the individual. Vitiligo can be prevented and reduce one's risk of attracting the condition by using a basic moisturizer on a daily basis, following healthy, safe sun exposure practices by using sunscreen consisting of 30% or higher if you know that you will be outside that day, as well as seeking shade as much as possible and wearing clothing that is capable of protecting one's skin from the sun and high UV rays. More ways include avoiding harm to the skin, such as cuts, body scars, burns, and injuries on the skin that may cause new spots to appear. Avoiding sun lamps and tanning beds as much as possible, as this heat can burn the skin, and a safer alternative would just be using self-tan. And also trying to avoid stress and maintain a positive mental health rate and maintain a positive, balanced diet. In summary, I have learned that vitiligo is a serious pigmentation loss condition and really anybody can get it, and it can appear anywhere on the body. It is better to be very cautious by following these prevention methods and home care tips. It is also important to know that if vitiligo is diagnosed in an individual, there are treatment options as well as counseling that they can do to know that this issue is quite common and they are not struggling alone. And this is my works cited page, and thank you so much for listening to my presentation.